everyone, welcome back to our podcast, the NUHS Care to Talk podcast. I'm Alina from the Wellbeing Office, and today I have a very special guest with us, Dr. Liz Crowe, all the way from Brisbane, Australia.
Hello.
So, this is episode 8 of our podcast, Liz.
That's impressive.
And it's all about well-being. Mm-hmm. So before I let you introduce yourself, I just want to frame what we're doing here today with this podcast. Mm-hmm. So we've had 7 episodes so far. We've talked about leadership, commitment, respect and civility, psychological safety, trust. Mm-hmm. Every person has a story, look beyond just the face. Mm-hmm. Culture and middle management, balancing the middle. Yeah. And then we thought we were done, but then you came to visit. And we realized that this was a great opportunity for us to tie that all together and speak to you about what's happening outside of Singapore.
Great.
So let's tell everyone who you are.
All right. So as we've already said, my name is Liz Crowe. I have worked in health for a very long time in Australia, predominantly in paediatric intensive care, where I was the senior social worker, heavily involved in the day-to-day care of families who were going through grief, loss, trauma, new diagnosis, and very sadly, palliation, death and end of life, and bereavement care. I did that for several decades. And during that time, what I noticed was as our teams got bigger, relationships were breaking down. We needed to be more intentional in the way that we lead and the way that we form teams. So I did a PhD on staff wellbeing, looking at risk and protective factors. And these days I work at the Royal Brisbane and Women's Hospital looking after the staff. And doing academic and research work around what really builds capacity for well-being and what's the longevity around well-being.
So I love that journey that you've taken. Maybe you can say a little bit more about what motivated this focus on communication and well-being, because I think those are the 2 big things that you're known for.
Yes.
What about your clinical experience and that journey brought you to realize that this is something you really wanted to focus on?
I guess, like lots of people, I got into pediatrics thinking it would be cute and you would be helpful. And very rapidly, because I'm older, when I first came into our career, we saw lots of babies and children die. I was living with a events coordinator and a travel agent, and often on a Friday afternoon they were taken out to lunch and they had all these lovely things to end the day, and I would be going to a child's funeral. And looking back, I dealt with that in a very damaging way. I didn't sleep very much. I probably drank too much alcohol. I ate my pain. I put on lots of weight in the first 12 months in pediatrics. And I probably really didn't look after myself well until I tried to get pregnant and had to kind of focus in on myself. And I think it really wasn't until I had my own children and I had this big call back to life that I looked back and thought, surely there was a way of doing this better. Then I was, my job was to look after families, but naturally as the social worker or the counsellor for that team, you're constantly looking out for your staff. And I noticed that as our teams got bigger, as people became less familiar to each other, they started to not speak as nicely to each other. They were quicker to judge one another, that people were talking about cliques and isolation, and I don't feel like this is a good place to work. And I was thinking, wow, we've got to really do this far more intentionally now that we're getting bigger, now that we're seeing greater patient acuity. That's if you'd met me 15 years ago and said I'd do a PhD and become an academic, I would have rolled around the floor laughing. I would have been like, I did the most basic mathematics you could do at school. Like, this is not my pathway. But, I'm 30 publications in a book. It's funny how things can lead you to a certain area and you change. But I guess people talk about well-being, I say, like it's yoga and juicing. It's not that. In health, we have got to be extremely mindful of ourselves. We've got to be so self-aware because we've got to change what we need to do for ourselves, what we need to do for our teams, our colleagues, our patients. And the only time we can excel in health is when other people are dying and critically ill. And that's a paradox that we do not see anywhere else.
In healthcare, we don't often sit to think about that. No. It is our normal, especially for those of us, it's our first job. You came straight out of school. This is all you know. we don't realize that this is not what the rest of the world goes through. And I think that just that realization of that point will make it clearer to us that we need to do something different.
Yeah.
What is or are the biggest misconceptions about well-being that you have come to understand?
So I think in health in particular, the biggest misconception is that challenge or being extended or being confronted by something means that you are harmed. And it doesn't at all. Like even being really distressed does not mean that you are harmed. If you want to excel in health, you've almost got to be like an elastic band. You've got to keep stretching and adapting to that situation. And as I said, if you'd met me in my 20s, I think I had some really maladaptive ways of coping. I think that I was really emotional often after work. I had what I would now call a lot of numbing behaviors, like eating to numb, drinking alcohol to numb, trying to escape what was going on. Whereas I think what we have to do is learn to lean in, wrap the support around, and help one another up to the next level. Do you know what I mean? Because if you want to survive well and excel in health, we have to accept that stress, distress, being confronted and being challenged are all part and parcel. And that's not the normal for people in other occupations. And so well-being, we have to take a huge amount of accountability for self because we're all going to be different. And then we've got to fiercely look after our colleagues and then encourage our leadership and our organizations to create an environment where we can excel.
So this is very interesting. You've talked about this being in healthcare for a few decades, but it's only now that it has become something that's really at the forefront, not just for you, but also for organizations, for systems everywhere.
Yeah.
What's changed over the last 20, 30 years that has made it much more of a crisis or something more urgent that we need to deal with? Or is it just that we didn't know and we didn't deal with it before?
I think it's probably very multifactorial, to be honest. If we look at something like doctor suicide, which gets a lot of publications, everything that I can find shows that since the 1980s, the rates of doctor suicide has been going down, not up. It's just that when things like that happened, it was shunned. It was never spoken about. It was never attributed to those sorts of things. People are much more likely to talk about their mental health problems now. So there's more stuff like that on social media. I think also patient acuity and complexity has dramatically changed over the course of our careers. And when we're in small, tiny teams, I know, oh, hey, you're trying to have a baby, or I know that you've just had a breakup, or that your puppy is sick and that you're distracted, or that you're finding somewhere to live. I know that because I have a relationship with you. So when you're one of 30, that's very different than if you're one of 300. A lot of our managers now are not necessarily health-based people. So when hospitals were run by doctors, there was a different attitude because people understood things. Now, there's pros and cons about being run by administrators, but there are so many things that have changed and we're still trying to do things the same, and it's not working. So we've got to be disruptors. We've got to find solutions to new problems.
And that was going to be the next thing that I was going to ask you. There's this big gap between what we know, and the evidence shows us that we should do, but that we actually do. So why are we not just doing what we should do? And when it comes to medicine, you see the evidence, we put it into action. What's stopping us from taking those steps and moving forward with?
There's a number of people in the room helping us record here. I'm sure if we ask them, how many of you don't understand what you should eat? How many of you don't understand that fruit and vegetables are important, that drinking water is important, that sleep is important, that movement is important, that connection is important? Everybody knows this. But today, how many people are not going to eat enough vegetables, are not going to eat enough fruit, are not going to drink enough water? And we can say, look, it's expensive, or it's hard to access, or it's this or it's that. But at the end of the day, we might prioritize buying a pair of shoes over eating green vegetables, right? Humans love habit and they love patterns. And we, for a very long time, have been in a pattern in the way that we look after or don't look after ourselves, the way we care or don't care for our colleagues. I think everyone is hoping something's going to happen that makes this easy. It doesn't make it easy. This is so embarrassing. I'm an academic. I've read all of this stuff. I've published stuff. And I got this off Facebook. And I think it's so accurate. It says, being single is hard. Dating is hard. Getting divorced is hard. Being married is hard. Choose your hard. Being thin is hard. Being overweight is hard. Being fit is hard. Being unfit is hard. Choose your hard. So life is not meant to be easy. Like anything that we want in life, if you want to be a good runner, if you want to play the piano well, if you want to be a good nurse, if you want to be good at your relationship, you've got to work hard at it. And I think we keep hoping there's an easy path to well-being, and there isn't. So choose your hard. Choose your hard with this, and be very mindful of your habits and patterns, because, it's almost impossible to break a habit. You've got to exchange your habits. So if you eat chocolate every day at 3 o'clock, come 2:45, your brain is like, chocolate. So don't just cut it out. Swap half a chocolate for half an apple. A quarter of a chocolate for 3/4 of an apple. Swap it out so that your brain gets used to, I am getting something sweet. It's just not chocolate. And it's the same. We think about, I want to exercise. So I haven't exercised for the last 7 years, but this week I'm going to go to the gym 4 times. And the first time we fail, we just don't go back. So I say to people, focus on this 1% better. It's called marginal gains. And start with something small. I'm going to drink more water. And if I do that well for 2 weeks, I'm then going to try to go to bed 15 minutes earlier. And if I can do that for 3 weeks, then I'm going to try and move more. If we tried to be 1% better every week, you're 50% better so quickly. That's better than trying something huge and failing and going back to our own old ways.
Yeah, and this really applies to systems as well. Everything that you're saying, I can think about the parallel to our system. We don't make the change because we think it's going to be hard, but we're not really thinking about the difficulties that we continue to struggle with because we don't make the change.
Exactly.
And that 1% better, we don't start new programs because we think, oh my goodness, we tally up all the things we have to do, and then we think, well, it's too big for us to do.
Yeah.
But we could just start with something small and then start to grow from there.
Yes.
Yeah. And you just spoke about it. Healthcare is difficult.
Yeah.
Hard things happen to us.
Very hard.
All the time.
Yep.
When we are involved in an incident, because we will all be, everyone, we always say this, if you work long enough, something's going to happen. What can we say to ourselves, or what can we do that's going to help us to keep moving forward and get through it, and in fact maybe grow from it instead of letting it set us back?
Okay, so 2 things I want to say about that. First of all, it's really easy to identify those big critical events, but sometimes it's the slow grind and wearing away in healthcare that really, really chips away at people's well-being. And then it takes something that they then identify as a big event that tips them over the edge. So I think it can happen both ways. But if you have a big critical incident, be very careful not to just pathologize it immediately. So sometimes when we've been really confronted by things, it just throws us enough that it throws our sleep out. Once people stop sleeping well, your mental health starts to become compromised very quickly. We need to not pathologize this, but we need to address it immediately. So the second you think, okay, it's been more than 3 days and I'm still not sleeping, go to a senior member of staff. And I say start there because if you go and see your general practitioner, you go and see a psychologist, they've had no experience in the health area. All they can do is pathologize it. Then once you've got a diagnosis, we know it's harder for people to recover. It's something like 80% of people who go on workers' compensation never work again. It's some profound number, right? So what we want to do is try to keep people close. The other thing is if I was to ask you, how many people know what post-traumatic stress disorder is? Most people have heard of it, right? If I was to ask you, do you know what post-traumatic growth is? Most people are like, no, I've never even heard of that. So what we know is even after a profound critical incident, so even amongst soldiers who've been in an explosion where people have died and people have lost their legs, within 12 months, about 80% of people are back at baseline. We're extremely resilient as human beings. And then there's a 5 to 10% variant either side where people might have post-traumatic symptoms, but not necessarily the disorder that can move to that. And people have post-traumatic growth. And post-traumatic growth is where people believe they are better than they were before. In 2019, something really horrific happened to me at work. And so after decades of working in health, you believe yourself to be resilient. You think, oh no, like I've got the tools, I can recover from this. And something happened. My personal life was also difficult at that time. And I fell in a big hole to the point that I was like, I'm not sure that I'm going to survive this. Like, I'm not sure that I can make this. I had some pretty dark thoughts, etc. What kept me going was my routine. So if I'd only had 90 minutes sleep, I still went to the gym. If I'd only had 90 minutes sleep and everything in me was like, I'm just going to buy takeaway, I steamed broccoli, I ate chicken, I stuck to my routine, I kept going, right? I look back in that period, like I had to do so many extraordinary things that I'd never had to do before. It was the first time I've ever had to go and see a therapist. I had to do a lot of work before I could compartmentalize and put that somewhere safe. But I believe I'm a better clinician. I'm a better well-being specialist. I'm a better human being for going through that horrific event, because it was so bad. It means that when several months later, one of my colleagues accidentally made an error that ended someone's life, I had more resources to help them. And that's post-traumatic growth. Do I wish that 2019 event had never happened? Yes, I do. It was terrible. But we can't be what we don't know. All of us can say, remember the worst day of our lives, right? All of us. And if we met each other in that time and said, are you going to survive? People would be like, I can't do this. If you met me in 2019, I would have said, I am broken. I cannot make this back. But I knew the literature. I kept my routine. I got help. I clawed my way back. I think it was 4.5 months before I lost a tremor in my hand. Like, I was in a bad way. I wish it hadn't happened, but I knew I had the hope that things could be better. And we need to talk about that post-traumatic growth and that hope that you can be better. Because if you don't even know it's a possibility, you can't strive for it. And sometimes these events happen and it is the end of your career in this particular area, but it's not the end of you. It's not the end of your occupation. You might need to change things. You might need a break. You might need a project. You might need to go and be a florist for a while. That may happen, but it doesn't mean you'll never come back, right? So we just need to know that all of us can have limits. All of us can be stronger and more resilient than perhaps we ever believed possible. But there's not enough talk about that in health.
When I speak to people in well-being, I think this is a very common thing that people tell me. They come into this because something happened to them.
Yeah.
And then they realized, and somehow they got through it. It was difficult, but they realized that they've grown and they want to give back. And that was actually going to be my next question, which was, how can we support each other? Part of the answer is to be open about it, to share what you have gone through and those resources that you mentioned.
Yeah.
What about at an institutional level? How do we help people? Because this is, again, going to happen to all our staff.
Yeah.
And some of them are not going to know where to go.
Look, I would love to be able to say, just put in this policy and everything's going to be okay. It's not. So we need to make sure, on the whole, 2 layers above us we don't see. So if I'm a junior nurse, it's my nurse unit manager and the layer above that. And apart from that, it's like needs to know basis. So we have to make sure that at every level of the organization, there are people with skills. There are people who have an open door policy. There are people who are approachable. I think I was reading something recently where lots of people say they didn't seek help because they honestly believed they could get there on their own, right? Lots of people in health are extremely intelligent. They've been able to problem solve or make sense of things their whole lives. So they had these events happen just like me. And initially I was like, I can do this. I've done hard things before. And then as the days went on and I still wasn't sleeping, I was like, oh my goodness, I am in trouble here. And then once you stop sleeping, you get this paranoia like, I'm not going to make it. And what's going to happen? I'm a single parent. How am I going to pay the rent? How am I going to put food on the table for my children? How am I going to, right? So the panic sets in and it gets worse. Like it's accumulation. And so I must say, because of who I am, people probably did ask me at the time, are you okay? And I would have been like, fine, I'm fine. I always think, watch the word fine. No one says they're fine when, fine is not a good word. So about saying to people, it's okay if you're fine, that's great, but I'm still here. I'm still going to pop over. I'm still going to encourage you to do this, right? Because when you're in such a disaster, you can't think clearly. You can't negotiate your way out. You can't find the EAP number. You forget that there are resources. We've got to be good allies to one another. So if you think that something is happening, and you don't know what to do, ask someone else in the organization, ring the wellbeing team, ask the nurse unit manager, ask the senior medical officer, ask the head of allied health. If you don't want to break their confidence, say, I'm struggling with this. What do you think is the next best step? Right? And a lot of this is multifactorial. When I got into trouble, what worked for me may not be what works for you. Just handing someone an EAP brochure is not a helpful thing. We've got to be more connected, more mindful, and we've got to have those relationships before people get in crisis. We can't all of a sudden step in and be a great leader and a great supporter because the trust isn't there.
The trust isn't there, yep. So we really need to know how to look out for each other. Yeah. And we always say this, if you feel that something is different, someone is acting different, you really got to think about why that is and has something happened and reach out to that person and not just... we tend to just, we don't want to bother them or maybe they just need some quiet, but just to check in.
Yeah. And when we ask people if they're okay, we want them to be okay. And if they're not, they pick up on that. So they say, no, I'm fine. But I always say to people, just say something like, it would be totally fine to not be fine. And you know what? If that changes, here's my number. I don't sleep very much, I say to people. So if I'm asleep, I won't respond. My phone is on silent, so just reach out. And like I say to our staff, email me anytime because the longest I won't see it is about 10 hours. If someone has reached out to me and they put something urgent, I see it and I respond immediately. More and more, I think people think social media is being connected. It's actually hugely disconnecting, and I'm very much on social media. It has a lot of place for us in our lives, but it never, ever will replace this touch, friendship, trust, etc. And we've got to fight to keep that going.
Thank you so much for joining us today again. I do hope that everyone listening took some gems away from that. If you want to connect with Liz, she's also on social media. Yes. She's got lots of podcasts that you can listen to get more. And please come back to our podcast as well. If you haven't seen the rest of the episodes, there's so much in there for you to listen to and engage with us on. Have a great week ahead. Thank you.
Thank you.